Hey, this is Dr. Elliot Hirshorn with New Life, and I just wanted to talk to you a little bit about what we're doing in regards to the COVID-19 situation. There's a lot of information out there from the news and the internet, but I want to talk about what we're doing here specifically at New Life to make sure that you guys are safe. Should you come into the office, we are still open as a medical facility. We are a wellness facility, so we don't typically see sick patients, and obviously we don't want sick patients coming into our office, even in general, but especially during this situation when we have most of our patients are well. We don't obviously want to be part of the community spread of the issue. So we have implemented a COVID-19 policies and procedures to make sure that we don't accidentally get someone who has potential exposure to COVID into the office. So I want to talk a little bit about what we're doing when patients come into the office initially. They'll see a sign on the front door that says, stop, read this, and asking them a couple of screening questions. And if they have any of the issues on the sheet, they're supposed to go back to their car, give us a call, and talk to us over the phone so we can ask them a couple of screening questions. So have you been outside of the United States in the last 30 days? Have you had any symptoms of fever, cough, sore throat, respiratory distress, all of the common symptoms of COVID? We want to screen for that. And then asking if they have had direct contact with a COVID-19 positive patient. So in asking those questions, we're screening to make sure that we're not allowing someone to come into the office that has potential exposure. And then obviously inside the office, we always use universal precautions with all of our patients, but we're kind of taking things to the next level as well in terms of making sure that even the staff doesn't have any signs and symptoms. So every morning before they even come to the office, we're having our staff take their temperature to make sure that they don't have a fever that would indicate any type of an infection, let alone the COVID-19 infection. So just kind of going through some of the other policies and procedures. When a patient comes into the office, of course, we use, as part of universal precautions, hand washing procedures, hand sanitizer. We're taking the extra step of wiping down commonly touched areas, doorknobs, front desk, those types of areas a whole lot more frequently, multiple times a day, just as an extreme precaution in regards to those types of things. And then obviously, if anybody has any of those signs and symptoms, we will send them home with a mask and ask them to go to their primary care doctor and get tested, so that we don't have anyone who is showing signs and symptoms showing up in the office. And then beyond that, what I want to do over the next couple of days is just kind of talk about some of the things that you can do as an individual to help you and your family to stay healthy. So how, there's no way to prevent 100% the potential of getting this virus because of the way it's spreading, but you can take the proper precautions that are recommended from the CDC and the other federal agencies, as we are doing, and the social distancing, limiting contact with people who have symptoms, etc. But then what can you do personally to make sure that your own immune system is healthy and functioning? So we're not talking about 100% prevention of the COVID virus, but you want to do things that help to support your own immune function so you have the potential to fight off an infection, whether it's COVID or otherwise. So the first thing I want to talk about today in regards to that is stress. So one of the things that we're all dealing with is, being bombarded by the news media, social media, friends and family. You're seeing a lot of information out there and you're kind of being overwhelmed, like, okay, now we're, depending upon where you're at, what state or town, maybe being restricted from doing things that you normally were able to do, even leaving your house. The bars and restaurants are shutting down in certain areas, schools are closed, so it's a very stressful time. And stress can weaken your immune defenses. So incorporating appropriate stress relieving techniques is going to be really key, especially if you're stuck at home. You'll have a little bit more time to do those things. But make sure that you're managing your stress well. So, there's different nutrition that you can use to help manage stress, adaptogenic herbs and things. But obviously, you can do things like meditation, prayer, mindful deep breathing. Things like those are going to go a long way to helping you manage your stress. The less stress you have, the less cortisol you're producing, and the less impact negatively to your immune system. So today's tip for boosting your immune function is to really just try to find a way to manage your stress. I hope this is helpful, and I hope that you and your family are safe and healthy as we move through this really worldwide situation that we're dealing with, and we all obviously hope and pray that it is over soon. And we'll be back in the next couple of days to discuss some other ways that can be beneficial for you as you go through this. Take care.